Welcome to our newest first episode of the Doctor's Tips. Remember, I'm always your host, Wagura, and today, remember, we have a very critical discussion. Our critical discussion today is on gonorrhea. Hello, doctor.
Hi.
Yeah, just tell us your name. Tell us more about it.
So my name is Dr. Leana Moloni Kanduki. I'm a pharmacist at Better Care Hospital, and I'm glad to be sharing a few tips with you today.
Yeah, welcome, doctor.
Okay,
now, today our topic is on gonorrhea. Everyone knows gonorrhea is a STI, is it?
Yes.
Now, tell us, what are these facts and what are the myths that you, as professionals, come to deal with? Since me, as an ordinary citizen, believe this is what gonorrhea. Now, what's your view on gonorrhea? What are the myths that we do come across that really makes your work difficult? Since everyone is coming with this perception, gonorrhea is just a simple, or is it a critical disease?
Okay, I will start by first explaining what gonorrhea is.
Yeah.
Gonorrhea is a bacterial infection.
Yeah.
Basically, it's a sexually transmitted infection, mainly caused by a bacteria called Neisseria gonorrhoeae. It's a bacterial infection. So some of the myths that we encounter on a day-to-day basis is some people come and say that gonorrhea cannot be cured. However, it can. It can be cured. It's treated with a series of antibiotics and it can be cleared. Another myth that we normally come across is that when a mother has, for example, a mother is infected with gonorrhea,
yeah,
it cannot be transmitted to the newborn infant. However, it can. So you see, it's always good to go through all the course of treatment, get tested, go through the course of treatment, and it can be cured.
Yeah. So this raises the next question,
okay,
how is it transmitted? We only know it as a sexually transmitted. So does it mean pure sex, nothing else, just a sexually transmitted infection?
Yes, it's a sexually transmitted infection.
Yeah.
Yes.
So do we have other types of gonorrheas, they are found in different species other than from the sexual basis?
No, basically, this is gonorrhea.
Yeah.
The sexually transmitted infection, which is found in human,
yeah,
is basically caused by this Neisseria gonorrhoeae.
Yeah. And what are these critical conditions or symptoms that can make one realize, oh, okay, let's do away with the self-treatment that we have used, Najikuna saw this gonorrhea. So what are the specific symptoms that when one have, you should rush to the doctors immediately?
So gonorrhea, once you are exposed,
yeah,
it takes almost 2 to 14 days for one to start exhibiting some of the symptoms. However, there are others who will never show the symptoms. So those ones we call them non-symptomatic carriers.
So do they have the symptoms, or do the disease have any infection to them?
So for them, yeah, they will not show any symptoms of gonorrhea, but they are carriers and they can spread it to other people. You see?
Yeah, so personally they'll never feel the pain.
They will not even exhibit the symptoms of gonorrhea, but they can infect it to someone else.
Yeah. So what are these symptoms?
So some of them,
for maybe those who live along the carriers now,
okay,
and a normal person who has just, you said,
exposed.
Yeah. So what are the symptoms that first, as the progressive way they usually show themselves?
So we are going to classify them in two. We look at the symptoms in men and the symptoms in women. So in men, some of the symptoms that they find is one, there is painful. They feel a lot of pain while they are urinating. And then number two, they may develop some swelling in the penis.
Yeah.
Then another one is that they will have frequent sore throats. Yeah, they are frequent. They keep on recurring. Yeah?
Yeah.
That's some of the symptoms. And then also they will have some discharge, which is mainly yellowish in color, that is coming out from the penile opening.
And these signs occur concurrently?
Yeah, they occur concurrently.
Yeah.
Yes. Now for women, yeah, they also have also pain during, or they feel a burning sensation when they are urinating.
Yeah.
Also even for men, they may feel pain or even a burning sensation during urination. That's a common symptom in both. Also for women, they may develop also the discharge. They'll have the vaginal discharge, which is also foul smelling, greenish color, yellowish, white creamy starch, like that, as it progresses. And then another symptom is that they may develop fevers also. And another one is that they also have an increased frequency in sore throats. also, which is also common even in men.
Yeah, what about this? They usually, I had people saying that in case a man and a woman contracts gonorrhea at the same time, there is a probability the woman will notice first before men. Is it a fact or is it a myth?
Just as we looked at it before, we said that there are some people who can be non-symptomatic.
Yeah.
They may never show the symptoms. So it's not necessarily the case that for a man, he will not show the symptoms and the lady shows the symptoms. It's not necessarily the case. They may show both of them. Actually, even during treatment, we always insist on treating both the partners.
Yeah, like the question is it a fact that a woman and a man, they contract gonorrhea at the same time, but now the lady will show the symptoms first?
It's not a fact.
So it's not a fact?
No, that one is not a fact.
And now tell me, who are these people who are at the risk of contracting gonorrhea?
So some of the people who are at risk of getting gonorrhea is one, for a person who doesn't have only one sexual partner.
Yeah.
And then at the same time, he or she doesn't use any protection when they're having any sexual intercourse with the other partner. So you see, that one is at the greatest risk of getting gonorrhea. And
what are these main complications that are brought about by gonorrhea infection?
So when we're talking about complications which can arise due to gonorrhea, we are looking at if people never go for treatment. Yeah. You see, now the infection will continue progressing. Yeah. So for women, when they never get treated, the infection continues to manifest in their bodies, and it may lead to even now serious cases like pelvic inflammatory disease, may even cause damage to their reproductive organs, and this may lead to even this woman will never be able to conceive a baby, or even when they conceive, the baby can develop ectopic pregnancy. An ectopic pregnancy is a pregnancy that can occur outside the uterus.
Or like the fallopian tube and such.
Yes. And you see, for this infection, it starts infecting other organs like the fallopian tube. You see, fertilization is very important in the conception of a baby. So you see, they'll never get to advance to even to go to term for their pregnancy. You see.
Yeah. So does it mean like gonorrhea usually causes what we call infertility?
Yes, it does. Yes.
And in men, in men it also causes infertility.
Infertility, and it also affects their sterility.
Yeah. And what are the scientific or the medical treatment required for gonorrhea?
So for gonorrhea treatment, you will undergo a course of antibiotics. Yeah. So you'll start with injections and then a full course of oral antibiotics, and then you'll get cured.
So Dr. Diana, what are these prevention measures that you as doctor usually prescribe to your patients?
So, for us, we always advise people to, one, either abstain, and if that's not possible, you make sure that you only have one sexual partner, you see. And if you have to have multiple, you make sure that you practice safe sex, that is, you use condoms. Because at least for any STI, it cannot be contracted when one is using a condom. You see, so basically that's it.
Okay, so you personally as a doctor, what's your view or what's your point to that patient who is undergoing, or that family member who usually know a person with gonorrhea, maybe they have taken it for granted, or that person who is sick and don't know how to do? What's your word to them?
For any person who is now sexually active, I always advise that they should get regular checkups. Yeah. You come and get tested for any sexually transmitted disease. You know, you never know where your partner has been or where they go or how many partners they also have. Yeah. So you make sure that you go for regular checks, and then you make sure you practice safe sex.
Yeah, wow, what an amazing show. Remember, it was all about gonorrhea today. Remember, our marvelous doctor, Dr. Diana, has always talked about this is Beraki Hospital, and the show has always been powered by Wilbur Adverts, the AT Entertainment, and the one and only big hospital that is Beraki. Remember to subscribe to our YouTube channel at Beraki Hospital and follow us on Facebook at Beraki Hospital. Remember, next week it shall be more sweet and more tastier. Meet me at the doctor's tip. I'm your host, Wagura Kariuki. See you next week.